had to see this coming. Question after question about staff shortages in hospitals.
My question to the Minister of Health.
Reflect on what it would be like to be unable to breathe.
How many hours will Londoners have to wait?
And whether the government was looking to privatization as a solution.
No, no, no.
Talking to reporters, an embattled Sylvia Jones acknowledged staffing is an issue.
The Canadian Federation of Nurses Unions is asking the federal and provincial governments to address a nationwide nursing shortage as soon as possible, as the situation in
came to a head this past weekend, with 2 Ottawa hospitals having to temporarily close their ERs. A similar situation is playing out in Clinton, Ontario, which was forced to shut the doors to its ER today.
Dorotea Orem Self-Care Deficit Theory by Gonzalo characterized nursing as a profession dedicated to aiding individuals, including those with disabilities. Nevertheless, the escalating shortage of nurses prompts an inquiry into whether the nursing profession can maintain the esteemed level of care envisioned by Orem, specifically here in Canada, where staff shortage continue to happen. Why is it a Canadian healthcare issue? Nurses are tired, drained, and quitting their position. Concerning number of emergency departments are shutting down. Patients are experiencing increasingly extended wait periods. Providers are uncovering serious illness in patients that should have been diagnosed earlier. Poor quality of care and outcome. Data evaluation, we can track metrics such nurse-patient ratios, vacancy rates for nursing position, overtime hours worked by nurses, improvements in nurse-to-patient ratios, the qualitative staff feedback, feedback by regarding workload management, monitoring patient outcomes, and patient testimonials.
In achieving our goal, we need first to understand the barriers. First and foremost, we need to understand that this is a competitive market. The US and the different provinces of Canada are also requiring nurses, that's why competition is high. Next is the financial barrier. In recruitment of nurses, we need to provide a competitive salary and budget is required on that. Next is the regulatory requirements, such as when internationally educated nurses wants to come to Canada, they need to study 1 to 2 years at least. And tuition fee here is not that low. And of course the geographical locations. Northern part of Canada is cold, that's why nurses opted out of working there. Now, to successfully implement our plan, we need to strategize. We need to properly allocate our resources, such as to the HR, to properly recruit nurses. Next, we need to engage our staff to properly understand why they are leaving or any issues that they are encountering in their workplace. We need to also to engage the patient to understand if they are satisfied with the services that we are providing. And lastly, continuously monitor and evaluate our plan to be able to align to the changes that is happening. Implementing improvements have great impact to the staff and the patient. First and foremost, to the staff will be able to have manageable workloads, reducing burnout to the nurses, and improves job satisfaction. To the patient, of course, enhances the quality of care, ensure the patient safety, and of course, increase patient satisfaction. On achieving our goal, we'll be using PDSA. On planning, we need to create an all-inclusive strategy to decrease nursing shortages in the healthcare facility. We need to understand the who, the what, and the where, thus we'll be able to collect the data properly. On the do, we need to roll out intervention in phases, starting with the departments experiencing the most critical shortages, conduct regular check-ins with the staff and leadership to gather feedback and adjust intervention as needed. On the study part, examine the gathered data to examine the effect of the intervention on the nursing shortages and associated outcomes. Contrast the pre- and the post-intervention metric to assess effectiveness. And the act, based on the finding, adjust intervention as needed. If successful, expand implementation facility-wide. Document lessons learned and best practices for sharing with other healthcare organizations.
This sustainability plan outlines our vision for the next 5 years. In year 1, we have to evaluate the situation. This includes the staff retention, turnover, recruitment, competencies, and salaries. This is to understand the organization's ability to retain talents and effectiveness of the recruitment strategy. Year 2, we have to continue to evaluate the staff retention and turnover. This is to provide insight for satisfaction among employees. And in year 3, the staff analysis to foresee staffing needs includes recognition program for outstanding employee and promote nursing as a profession. And in year 4, building plans for the future nursing leaders, engaging with communities to raise awareness to promote nursing as a profession. And in year 5, evaluate the 5-year plans, assessing the effectiveness of 5-year plans and the overall impact to our organization goals and objectives. This is to evaluate the strength and weakness of the current approach, forecast future challenges, and trends to plan accordingly. Transformational leader shared goals and inspiration, guiding us towards positive change. Implementing this approach can serve as an effective strategy for nursing shortages. Transformational leaders have a clear vision for the future, prioritize the growth and well-being of their team, adapt to the new ideas based on the finding research and theories, and collaborate with other leaders. These include sharing of resources and policy changes. These are the resources required to sustain change. The government play an important role in terms of financial resources. These include the budgets, the allocation, and the staffing adjustment. The human resources guarantee sufficient staffing and training for employee, and the technological resources involve software system, equipment upgrades, and infrastructures. This is essential for the enhancing of efficiency, accuracy, and the improved patient's outcome.